Good. Okay. So I'm going to come into my room, introduce myself. My name is Morgan. I'm going to be your nurse today. I'll perform my hand hygiene. I will ask for the patient's name and date of birth, and I will also ask about allergies. Once they tell me that if they have any allergies, I'm going to follow the allergy question up with a specific allergy question. I'm going to say, are you allergic to latex? And then I'm also going to ask, are you allergic to iodine or shellfish? Because of the components that are in the Foley kit, I want to make sure to be a little bit more specific about those as well. Once I've confirmed that they don't have any allergies, hopefully, then I will explain the procedure to them and why it's being done, and then I will get them ready for some peri-care. For the males, it's obviously going to look a little bit different, but we're gonna do it with a female today. So I'm going to set them up. If there are not blue pads underneath them already, please make sure you put some, because this can get a little messy. And then I like to place their legs a little bit butterflied out. It's going to be different with every patient because obviously some patients are not as compliant and sitting still as others, like my OB patients. I'm going to grab some washcloths. I'm going to grab a basin to put some warm water and soap in it. And then I'm going to get my gloves. I'm going to do my hand hygiene again. Put my gloves on. And I'm going to perform my peri-care. So I'm going to use 3 different washcloths, but if you use one, that's fine. Just make sure you use 3 different spots on that washcloth. So I'm going to hold the labia apart for my female. Okay, I'm going to take and wipe down one side in between the labia majora and the labia minora. Get rid of that one. Get another one with soapy water on the other side between the labia majora and minora. And then my last one will go straight down the middle between the labia minora. Okay, from there, I will get rid of all of my cleaning supplies. I will take off my clean gloves, throw them away, perform my hand hygiene, and then I will put on a new set of clean gloves. And during the check-off, if you do it exactly the way I just did it, verbalizing that along the way, that's completely acceptable because I know that your hands get sweaty. So from here, I'm going to make sure I have my kit and everything I need for the actual procedure. So I have a Foley kit and I have my sterile gloves, and really that is all you need. I'm going to open up my Foley kit and I'm going to move the bag. I prefer to set my Foley kit up on the bed. You can set it up on the table. You just have to be very careful when you move it that you do not break sterile field, okay? So again, I'm gonna set it up on the bed, but you just do whatever works best for you for the check-off purposes. So from here, I'm going to open my kit. I'm gonna open away from me first, either side, and then towards me last. And sometimes they stay better than others. Just making sure I only touch the outer 1 inch, okay? I'm going to take the drape that's on top out with my clean gloves because this is going to go under their bottom. So I do not have to do that with sterile gloves on, okay? I'm going to actually move the kit a little bit so that I don't overlap. I'm gonna take with the shiny side down, place this underneath my patient the best I can. And then I'm going to remove my clean gloves. Without turning my back on my sterile field, I'm going to grab my sterile gloves, open those up, put them here, hand hygiene again. And then I'm going to go ahead and put on my sterile gloves. Told you I took the bad one. So, putting my sterile gloves on. I took these so that all the students can have the good ones. Okay, so I have my sterile gloves on at this point. Now I'm gonna take the gloves that are in the kit and throw them away. You guys will probably have already thrown those away because of the fact that you've already removed them from it because you'll be reusing the same kit. But those you need to keep. I like to go ahead and turn my kit and kind of set it out so that it'll keep my sterile field nice and open. I will take my top drape now. I will open it up, and this drape has a shiny side, so I want that shiny side to go down towards the patient. And I'm going to place my drape on long ways because it has less likelihood of folding in on itself. Okay. From here, I'm going to prepare my equipment. So I'm going to open up my swabs, and I can either pull them out so that I can reach all 3 of the swabs, or because this is a sterile field, I'm going to set them on the kit. I'm going to take my syringe, take the top off, and make sure I have a really good seal when I put my syringe in here. Notice how I'm pushing nice and strong. Because if you don't and you start pushing too hard and fast, that syringe is going to separate itself and you're going to have water everywhere. And then I'm going to take I'm actually going to remove I'm going to remove my specimen cup because we're not going to need that for this procedure. But obviously if you need it for the procedure, then you would keep it on there. I'm going to take my lubricant. I'm going to place it into one of the spaces on the top. And I'm going to remove the covering on the catheter, making sure I have a good grip on the tip of it because I don't want it to just go flying around and accidentally touch something. From here, I'll put the tip of the catheter into the gel. That will help hold it in place. And at this point, everything is set up. Because in just a second, when I start my procedure, I will have one hand that is not sterile anymore. So it's going to be a lot harder for me to put anything together that I missed. So at this point that I'm going to use my non-dominant hand to separate the labia. I'm going to take the first swab, go on the side away from me. The second one, the side towards me. And the third one down the middle. And once I've done this, I cannot let go of the labia because if I do, it's contaminated and I need to clean it again, okay? So you really need to hold on tight. Then at this point, I need to get my kit moved a little bit closer to my patient. So as long as I'm touching the part that's still sterile, I can move all of this closer. And honestly, I can even move that out of the way. But I want to get this box a little bit closer. So again, I'm not like pulling everything with me while I'm actually trying to insert the catheter. I have a nice grip towards the tip of the catheter so it doesn't flop everywhere, and also so that it doesn't touch as I'm inserting. I'm going to find the urethra. I'm going to insert the tip of the catheter, and again with my dominant hand, I'm going to keep threading it. At some point, I will say I see my flashback of urine, and I'm going to keep going in about 2 to 4 more inches. Okay. From there, once I feel like I'm in a fair amount, I'm going to stop and I'm going to hold on to the catheter with my non-dominant hand. I realize that's breaking sterile technique. However, this part of the catheter is not going any further into the patient, and it's going to be contaminated by everything out here around it. So at the end of the day, as long as I'm not pushing the catheter in further, it's going to work just well. But I also don't want the catheter to fly back out at me until the balloon's blown up. So I'm going to take the syringe and I'm going to slowly inflate the balloon. Do not let go of the syringe because otherwise the water will come right back out into the syringe. At this point, I can let go of the catheter because the balloon is going to hold it in even if it does start to come back out. So I'm going to remove the syringe. I'm going to gently pull until I feel a little bit of resistance. I'm going to remove my drape. I'm going to take my catheter and If I don't have a sat lock on my patient, I'm going to place one on my patient. But if I do, I'm going to use the sat lock to anchor it into place. Now, honestly, to me, that's a little bit too far. The ones that they have in the hospital, they will generally hold both of the pieces, but you don't want it to have too much slack because then it can get kinked in the patient's legs, but you also want to have enough slack so that they can move their leg around. I will take my Foley bag and I will attach it to a non-movable part of the bed below the patient's bladder. In your kit, you will have a label, a yellow label that you are going to put your initials, the date and the time, and you need to put that on the bag. As long as it's not covering up numbers, it doesn't matter where it goes on the bag. And then I'm going to perform pericare again on my patient at this point, okay? So I'll perform pericare again and then cover them back up, provide for privacy, make sure the bed's low, locked, all of that, okay?